My name's Eli. I've been on the road speaking basically since 2005, working for Tony Robbins, and last few years done my own thing. So I travel, I speak at events, I teach mindset, communication. I was arm wrestling a buddy when I was maybe 20 years old, and he was like 350 pounds, and he couldn't beat me. So he just put his arm up like this and he jumped on my shoulder, and it tore everything here. It's not a natural scoliosis like most people have them with their kids. Mine's from an injury after the age of 18. And so just over the years, that compensation pattern and working out just forced a unique curve. The apex of the curve is right towards the heart. And so probably had a few more years before it would stop my heart.
Traumatic scoliosis and idiopathic scoliosis are completely different in terms of causation, meaning that an idiopathic case is an unknown cause, and the causation factors could be multifactorial more than likely. It could be anywhere from hormonal, growth development, asymmetrical growth patterns. It could be even nutritional. It can be even genetic concerns. There's a lot of factors all out there. When it comes to traumatic scoliosis, it's trauma. Trauma causes a curvature, and in Eli's case, it seemed to be a pretty physical trauma to his upper body, using more than one extremity, using his arm. That caused the curve to either shift and develop in that area that caused something that we call an atypical curvature. Okay, and atypical curvatures have their own type of concerns as well. When we talk about atypical curvatures, what we're talking about is curves that don't follow the normal pattern of scoliosis curving. Scoliosis curvatures typically curve in the lumbar curve to the left and the thoracic curve to the right, meaning they move away from the heart, and innately that's what the body does. We don't know why, just 90% of curves or so do that. They have left lumbar, right thoracic, or a right thoracic, or just a left lumbar, but they're always tending to bend away or going to the right in the thoracic spine. With Eli's curve, it goes the other way. It goes towards the heart. And the concerns there are, of course, physically, that if the spine's going towards the heart, if it continues to rotate and turns, there could be some physical manifestations to some problems in those areas. But when we look at causation, that's normally not just an idiopathic scoliosis. We're normally looking for other signs or problems. One being some type of neurological pathology, some type of neurogenic cause, something within the spinal cord itself. Those are typically could be associated with these types of cases, or of course trauma. And with Eli, we know the pathology was trauma. That's what caused that curve to shift in the opposite direction that we would normally see in an adolescent idiopathic case.
I was at my chiropractor's office in West Palm, him consistently saying, you've got this curve, and there's only so much we can do here about it. Dr. Tony's the best in the world. COVID happened, and I had booked seminars. All my events got canceled. I finally just made the commitment. I was like, I'm here, I'm not speaking, I don't have any more excuses. I need to go do it, and I've been putting it off, and again, I wish I had just come sooner.
Another concern with traumatic scoliosis is sometimes the rate of progression. They can progress faster, a little quicker, in a non-typical time when curves will progress. So when we look at scoliosis cases, idiopathic cases, they progress mostly in adolescent when they're growing rapidly, and later stage life, 50, 60 years of age plus. With traumatic scoliosis, they tend to progress right after the onset of the trauma. So something happens, it causes the curve to occur, and then it starts to progress relatively quickly, right after that trauma. So traumatic scoliosis can sometimes go out of control really quickly, really fast, and lead to degenerative factors in the spine at a time that we normally wouldn't expect the scoliosis to progress.
When I met with Dr. Tony, he walked me through the process and just really gave me a much more in-depth diagnosis, looking at the x-rays, looking at what's going on, looking at what's going to happen in the future. He was just really honest and really direct with me. We've reduced my curve by 50%. It was 34% at the main curve, and then, off by about 15% in the neck. And right now I'm sitting around 17% here. So at 43 years old, to have that much of a reduction is really unheard of.
With traumatic scoliosis, there's the first mechanism is the trauma that causes the scoliosis to occur. And the amount or the degree of scoliosis that happens from the trauma is directly related to the size of the trauma. We don't know what Eli's curve was at that time, but all we have record of is that he noticed instant posture shifting and asymmetrical shoulders, so we knew something happened. Typically, the scoliosis regrets relatively rapidly in a short period of time until the body can respond and try to heal, meaning stabilize. It heals and stabilizes. Wherever that stops, maybe 3, 4, 5 years after the trauma, then the traumatic scoliosis takes on the role of a traditional scoliosis, meaning compression over time causes the curve to progress slowly. And of course, as the curve gets bigger and bigger, it causes more problems and more pain, just like it did with Eli. Even though he was seeking some conservative treatment, but it really wasn't influencing the progression, because now it needs to be treated like a scoliosis because it's so far away from when the trauma actually induced it.
The consistency from the staff following up with me, who has been, on a scale of 1 to 10, they've been 100, warm, sincere, kind, just walking you through every step of the process. They really allow you to integrate and immerse you in a system that you can take home and really begin to manage the challenges that anybody could have. So I can see that I'm more open, I'm more connected to my body and my voice. I just feel better in my body, being able to move without pain. Just more connected, and I'm able to do activities like go for walks. I'm not running and doing marathons every day because I know that would probably create too much damage, but I'm able to move, I'm able to work throughout my day and not have to worry about it. Now I've got a real system that allows me to maintain a really awesome life and still be really productive.